If you and your doctor decide that knee replacement is the best treatment option for you, you should completely understand the risks and complications associated with the procedure. Medical risks of knee replacement surgery include infection that develops in the surgical wound or deep around the prosthetic implant, blood clots involving the leg or lungs, complications from anesthesia, nerve or blood vessel injury to surrounding tissues, wound complications, postoperative bleeding, possibly requiring blood transfusion, medical complications such as pneumonia, heart attack, stroke. Other problems may occur with the implanted joint itself over the life of the patient or lifetime of the implant. Although infrequent, these problems can occur and include loosening of the knee implant where it is fixed to bone, breaking or wearing out of the implant itself, problems with the kneecap or patella, including dislocation or fracture and/or failure of that implant, swelling and continued pain and stiffness. It is important for anyone planning on a knee joint replacement to understand that an artificial knee is not a natural knee. Some people may not be able to squat or kneel as easily or as fully as they'd like. Also, your surgeon may not recommend that you do so. Before, during, and after surgery, your medical team will take many steps to avoid complications. For example, they will perform various tests to ensure you can safely undergo surgery. You will be given a medication to thin your blood to help reduce the risk of a blood clot. To prevent infection, you will be given antibiotics before the start of your surgery. This will be continued for 24 hours after your operation.